What's up everybody, my name is Eric. Welcome to my channel, Eric the Tutor. What's up everybody, my name is Eric. Welcome to my channel, Eric the Tutor. Today we're going to be going through some of the muscles of the pectoral girdle. So today is basically week 1 summary. This is a lab 2 summary of CHA 101. So my videos are designed specifically for CHA 101 students. I'm hoping to try to help as many students as I can. That's my goal. But this anatomy applies to just about anybody who's interested in studying or anybody who's taken the course elsewhere. So I'm going to go through some primary, secondary, and tertiary questions of the muscles of the pectoral girdle and go through some important ones that I think are high yield. But really, this is just to get you guys practice, give you guys some practice on how to think through some of these problems and how we can ask some questions, okay? Alright, so let's go through it. So I'm just going to go through some practice problems, right? So you guys, pretty much the goal is to identify them in lab. Now it's just kind of refining those skills and starting to go through some secondary and tertiary tougher questions, okay? So let's jump through it. The tag structure here is innervated by which nerves? So one, we need to know what the tag structure is. So this is the pectoralis major. So here's my pectoralis major. And we need to know what innervates the pectoralis major. Well, the medial pectoral nerve does more, so medial for more. So I know my medial pectoral nerve does both the pectoralis minor and my pectoralis major. So here's my medial pectoral nerve and my lateral pectoral nerve, right? Because this is such a bigger muscle, it's going to have two different nerve supplies, okay? So that's one different type of question, okay? So we covered that muscle. And let's do a different one here, okay? So how about I tag right here, and I say right here. Identify the tag structure, and the tag structure is damaged. Therefore, what kind of actions would be lost? What kind of actions would be weakened? Okay, so that's a tertiary question right there. So I tag some part of the bone, right? They could tag the bone with or without muscles attached to it, right? Here it's kind of helpful because you can see the muscles that are attached to it. But they could tag a bone and not have anything, just the bone itself, right? They could just tag a scapula. So here's my coracoid process of my scapula, right here. So my coracoid process of my scapula, that's the first thing we need to identify. Then we need to know which muscles come off that particular location there. So I actually have the pectoralis minor, and my coracobrachialis muscles, okay? So those muscles are kind of inserting there onto that coracobrachialis, or originating, okay? So that's secondary, and then tertiary is knowing the actions of these muscles. So now we need to know, okay, what does pectoralis minor do? What do you guys think? Yeah, pectoralis minor does protraction, and it also does scapular stabilization. And then my coracobrachialis muscle, kind of attaching to the medial shaft of my, humerus, also is going to have a, let's get this one out the way. Here it is. Coracobrachialis originates at the coracoid process, inserts into the medial shaft of the humerus. So this is going to do a deduction and flexion of the arm. All right? So that's a different type of tertiary question we could have asked right there. Okay? Cool. What's this structure right here? Identify the tag structure. Yep, that's going to be my acromion. Cool. Let's see. Identify the tag structure. So right here, what's tagged? So it looks like it's the clavicle that's tagged. Specifically, it's one end of my clavicle that we're going to need to know. So that's going to be the sternal end. So this is my sternal end. So specifically, this area right here is my sternoclavicular joint, right? Because here's that sternum, and here's that clavicle. So this is my sternoclavicular joint. So don't forget to study your joints, study your bones, study your muscles. All right? Let's keep going. So we went through our pectoralis minor and our coracobrachialis. Let's go ahead and get those out the way. So the muscles that's tagged is innervated by which nerve? So we need to know which muscle this is. Which muscle goes kind of along ribs 1 through 8 here? Yeah, it's going to be my serratus anterior. And we know it's innervated by the long thoracic nerve. Long thoracic nerve. Another quiz question. The structure that's tagged, the nerve that innervates the tagged structure is damaged. Therefore, which actions are affected? Or lost, in this case. So we identified it's the serratus anterior. I said the nerve that supplies the tag structure is damaged, so we know that's the long thoracic nerve they're talking about. So if my long thoracic nerve is not supplying my serratus anterior, then which functions would be lost? What does the serratus anterior do? It does lateral rotation of the scapula. That's what my serratus anterior does, lateral rotation of my scapula. So if that nerve is affected, then we would not be able to raise our arms above 180 degrees. So 0 to 15 is supraspinatus, and 15 to 90 is the deltoid. The serratus anterior will take us above that 90 degrees. Okay? 0 to 15, supraspinatus, 15 to 90, deltoid, above 90, serratus anterior. Okay, so now we covered that. Let's keep going. So let's say they tagged this part of the bone here on the lateral side, kind of has a tuberosity. They could tag that and say the muscle that inserts onto this bone, this bony structure, is damaged, likely due to a nerve lesion. Which nerve was affected? So one, you'd have to identify is the deltoid tuberosity. Then we need to know, okay, the deltoid inserts there. Now I need to know the nerve that innervates the deltoid. The nerve that innervates my deltoid is my axillary nerve. Axillary nerve. Okay? Let's do some more problems. So here, how can I identify from this view my teres minor and my teres major? There's a lot going on. Well, there's a couple things we could do. One, I really like to find my long head of my triceps. You guys haven't learned this yet, but this is something I would try to learn. Here's my long head of my triceps. Look at that. My long head of my triceps separates these two muscles here. I got one here and one down here. So my long head of my triceps separates my teres minor, which is superior, from my teres major, which is inferior. So that's one way I like to do it. But I always like to confirm, right? I try to have many ways to for sure be like, okay, yeah, that's this muscle. So the teres major goes to my inferior angle of my scapula. Check this out. Here's my inferior angle of my scapula. So this is my teres major. So we can get rid of that one. And then running along the lateral border of my scapula is my teres minor. So here's that teres minor. So let's look at the teres minor on the other side. So what's the name of the structure where these three rotator cuff muscles are inserting? What do you guys think? Yeah, it's the greater tubercle of the humerus. The greater tubercle of the humerus is right here. So here's that greater tubercle of the humerus. We know it's more kind of on the lateral side. So greater tubercle because there's lots of things attaching to that tubercle, right? So what attaches to that tubercle? We have the supraspinatus, my infraspinatus, and my teres minor, right? So those are three rotator cuff muscles going to the greater tubercle of the humerus. And on my anterior side, I have a lesser tubercle. Here's that lesser tubercle. Which muscle inserts onto the lesser tubercle of the humerus? Yeah, it's that subscapularis muscle. Check that out. Subscapularis muscle, all right here, attaching to my lesser tubercle of my humerus on the anterior side of my scapula, right? This is anterior view. So it kind of originates off the anterior side of the scapula, up the subscapularis fossa, and inserts there into my lesser tubercle. Cool? So those four muscles make up the sits muscles. Those are the rotator cuff muscles. So you got a supraspinatus above the scapular spine. You got an infraspinatus below my subscapular spine. And you got that teres minor and the subscapularis on the other side. Cool. All right, so this big muscle here is innervated by what? Yeah, so this is my trapezius muscle. So it's going to be innervated by that spinal accessory nerve. Spinal accessory nerve. Great. What kind of actions does it do? wow, it does a lot of actions, right? So it's attached to the skull, attached to the base of the skull, so I can do elevation of the neck. I can also do some elevation and some depression of my scapula, right? Because we got lots of attachments over here to the scapula. We got attachment to the scapular spine. Here's that scapular spine. We got an attachment to the acromion. And we also have an attachment to the lateral 1/3 of my clavicle, right? Lateral 1/3 of my clavicle. That's all trapezius. All trapezius, okay? So, yeah, I mean, you can see here that there's a lot of things we can ask. I want to go through a couple more muscles and we'll just try to wrap up here. So, the way to distinguish between some of these muscles here, so what do you guys think? Try to identify for yourself real quick. What are some of the muscles that are going on here? So, I have my scapular spine. We know my scapular spine kind of has this base over here. So my base fans out just a little bit. See how it kind of fans out, fans out. So here's that base of the scapula, of the scapular spine. At the base of my scapular spine, I have a muscle. Above the base of my scapular spine, I have another muscle. And below the base of my scapular spine, I have a third muscle. So this is our landmark to figure out what muscles are here. So at the base, I have rhomboid minor. Above the base, I have levator scapulae, and below the base, I have rhomboid major, okay? So another way to tell is your levator scapulae, when you guys look at it in lab, kind of runs superiorly, right? So it kind of runs in this upwards direction. And that makes sense, right? Because what does our levator scapulae do? Yeah, it elevates the scapula. So that kind of makes sense that it does that, right? And then here we have the rhomboid minor, kind of running more to the medial side, and here's our rhomboid major also running towards the medial side. So those striations aren't really traveling superiorly. They're kind of traveling more medially. All of these muscles are innervated by the dorsal scapular nerve, right? Dorsal scapular nerve. Great. And then these two muscles in particular can help with that medial rotation of the scapula, right? And anytime we talk about rotation of the scapula, we're referring to which angle? Yeah, we're referring to that inferior angle of the scapula. So these muscles are going to kind of bring this scapula closer to the midline, right? So that's medial rotation of my scapula. Medial rotation of my scapula. Awesome. Last muscle I want to talk about here is what's this muscle here and what's it innervated by? Yeah, so it's my latissimus dorsi, and it's innervated by that thoracodorsal nerve, okay? So it's got some origins here along the spines of the thoracic, lumbar, and sacral regions, and even the iliac crest, right? So that's pretty cool. Right, attached to that hip bone. It kind of wraps around, right? So it starts posterior. We're looking at the posterior view, and check that out. It kind of goes under the arm, kind of through the armpit, and wraps around on the anterior side, and inserts onto the humerus. So if it inserts onto the humerus and it originated on the spines of the vertebrae, right? Then we know we can have some sort of actions on the humerus. So it inserts onto where? Yeah, it inserts onto that intertubercular groove of the humerus. So when it does that, it can kind of medially rotate, right? So origin pulls on insertion. That's the way things work with these muscles when they contract, right? So when that origin pulls on this insertion, it's going to pull this towards this way, right? It's going to medially rotate that arm, And since that origin is also posterior and this insertion is anterior, I can also extend this arm. So I can kind of move this arm backwards, right? So extension would be moving this arm backwards here, right? Moving it posteriorly, okay? That would be extension, okay? And then we can also do adduction, right? So since it's kind of, if this arm was abducted a little bit, I could adduct this arm closer to the midline. Cool. So that's pretty much just a quick summary of all the muscles. Make sure you guys go through them in lab. Make sure you guys prep and do that secondary, tertiary information, and always are quizzing yourselves and stay inquisitive and try to think of like different bony attachments and the origins, insertions, and yeah, just keep up the good work, guys. Thanks for tuning in. We'll see you next time.